Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Delighted to be back with you on this near spring morning. We have a really remarkable program this morning. We are joined today by our guest, Michelle DeMartino, but she's really not a guest. Michelle is the owner and proprietor of an interpreting company here in Kansas City, and you will often have seen her on our program as one of our lead interpreters. But she has also had a story of how COVID-19 has taken a tremendous toll on her family, and she's going to tell that story in just a moment. Also joining us is psychologist Greg Nawalanic, who's here to talk about offering advice for overcoming grief, fear, and the impatience we're all having around the pandemic and wanting it to be over and to get vaccinated right now. And in the meantime, we're hearing some reports that there are some places that are saying don't wear masks anymore, including some hospitals in western Kansas. We're going to run that down because I just want to tell you, I'm not sure that's the right idea. I don't think the CDC is suggesting that yet. And I would say to you, you know, everything that goes around comes around, and coronavirus is still out there. So we're going to run that story down. We're going to learn more about it, and we're going to talk more about that. But right now, let's talk about our numbers.
Yeah, the numbers here look pretty good right now.
They are better.
24 active infections with 8 in the ICU and 6 on the ventilator.
What was that number?
24, 8 in the ICU.
I do like that number.
That's really good.
Yeah.
30 with that in that recovery period, so 54 total patients, which is a very good number. We were getting concerned when we were up to 35 or 38 acute infections. Hays does have 14 with 9 in that acute phase and 5 in that recovery phase. But, you know, is what we're going to be talking about today, I think we need to also talk about and understand, you know, the deaths are extremely important. The mortality continues to be extremely important. There was a report that looked at, you know, we've had over 500,000 deaths in a year from COVID-19. If you look at the last 5 or 6 years with influenza, those 500,000 deaths just make so much greater than all of those years combined with influenza.
20 times influenza.
You know, Hays had 2 deaths overnight. We didn't have any, but total from our hospital in acute infections, 329 deaths to date. So
that's a big number, isn't it? And if you think about 500,000 people, more than 500,000 people have died, and we are nowhere near the end of this. So it's going to go higher.
Yeah, I mean, even for our hospital, I would say it's probably a decade or more before you get to 329 deaths from influenza itself.
Yeah, at least that. Probably even longer, I would say.
Yeah.
And then if you think about it, we know that the number of deaths from COVID continues to rise, and that the number of deaths is greater than World War I, World War II, and the Vietnam War combined. And if you stretch that out, those wars occurred over a 15-year or so period. This is in a single year.
Yeah.
That is unspeakable,
yeah.
I think. It's unspeakable, and unfortunately, it should have been more preventable than
But I think there is hope because, you know, if we are looking at vaccine efficacy from preventing disease from COVID-19, and the 2 vaccines that are emergency use authorized, and now J&J, which has submitted theirs, that vaccine efficacy preventing death and critical disease is really, I would say, exceptional almost, and much more than what we thought.
And information being presented today about nursing home vaccination and the drop in the number of COVID deaths. I mean, it's just, it brings tears to my eyes as I looked at that article this morning and think, oh my God, it so works. And then overnight, article published in the New England Journal of Medicine about the Israeli data showing the impact in not a perfect population comparison, but good, looking at people who have not been vaccinated. And it's just, there's no question, it works, and we just need to get more vaccine. Well, let's first see if there are reporter questions out there before we get into our conversation today.
Good morning, Cody Holyoke from KMBC 9 News. Hey,
how are you?
Morning. I'm doing all right. I get a lot of questions about the Johnson & Johnson vaccine. So with it getting close to emergency approval, I figured I'd ask. A lot of people have at least talked about online, hesitating and maybe, you know, I'm not going to get Pfizer or Moderna. I'm going to wait for the one that's more traditional. I hear that a lot. Do you think that the EUA of this may ease some fears or hesitancy about getting the vaccine? And do you think people may wait to get this Johnson & Johnson shot? Should they wait to get it?
Yeah, great question. Well, first of all, but it's not been approved yet, but all indications are it's going to be, and I think we're really optimistic about how it looks. And I was impressed to see some of the preliminary data about prevention of hospitalization and deaths, which is near 100% on the J&J, which is so very similar to Moderna and Pfizer. So that's great news. Single dose, that's great news. Hawk, do you think that people will be more likely to take this because it is a little bit more of a traditional approach? And do you want to maybe explain that to our audience?
Yeah, I mean, I hope this is one more piece of evidence to get those vaccine hesitant people to become less hesitant and take it. This is a viral vector, so it's a virus, but it's an adenovirus. It's one that our body sees all the time, not necessarily this particular subtype.
This is from chimpanzee, I think, or something like that, right?
Yeah, I think this one might be human, but the AstraZeneca, I think, was a chimpanzee.
Maybe that's it. Yep.
But adenovirus vectors or adenovirus, they've been studied as well for a long time. But what it does is it actually has the spike on it, the coronavirus, the SARS-CoV-2 spike, and that will help elicit an immune response. So again, it's still older platform, older technology, just as Cody talked about. We know these things have been looked at before, and it didn't just come out last year, but the technology itself has been around. So hopefully that will ease people's concerns. And the side effect profile looks very good as well. So I think
it looks very similar to the other ones. And just to say, just for folks who need a little reassurance about Moderna or Pfizer, vaccine side effects occur within the first 6 to 8 weeks, and really in the first 3 to 4 weeks. And we're well into that now. We've vaccinated over 25,000, 30,000 people, I think, here at KU using Pfizer and Moderna. We just haven't seen severe side effects. We just haven't seen that. And I think that's great news.
And I would like to say, when the mRNA vaccine gets injected into your body, your cells actually start to make the spike protein from the RNA that's injected. We should say here that this is a non-replicating viral vector, meaning this virus is just injected into your body and it will not replicate. So
the Johnson & Johnson.
Yeah, the Johnson & Johnson. So it's injected, and that in itself will cause the immune response.
Which is typical of how other viruses are, to the point that Cody made, it's typical of how other vaccines have been built traditionally. So all of this is really good news. Right now, I think thinking that you're going to wait for it, I would discourage waiting, and here's why. J&J thought they're going to ship 100 million doses to start. Now it looks like 10 million. So they've had some problems getting ramped up. We think that they're going to get full scale, maybe more toward that. I'm here in April, May, which is really going to push the vaccination timetable back a little bit. At the same time, Moderna and Pfizer have found ways to increase their production, which is great news. And they're going to ship, for example, Moderna is saying that they want to push more vaccine into a vial, which is great news as well. And I think the FDA will likely approve that. And in addition to that, they're beginning to alter their vaccines to take on some of these variants already. So I'm just saying to the folks out there, listen, don't wait because you think one's going to be safer than the other. The reality is that we've got lots of evidence now that Moderna and Pfizer are incredibly safe. And the same thing's true of I think it's going to be true of J&J, as well as eventually, hopefully, we'll get some AstraZeneca and then the Novavax out there. So I think vaccines are safe. The only thing that's not safe about a vaccine is when it's not in your arm. When it's in your arm, that's when you're safe. All right, other questions? All right.
Fox 4 wants to know, Moderna said that it altered its vaccine to protect against one COVID variant. Would people who've already been vaccinated with both shots need to also get the booster as soon as possible when it comes available?
Yeah, great question, Hawk. And what we know is they are altering it, and I think that'll be a good thing. I think, as I understand, I read this yesterday, and they were going to try and do 3 different phases of this. One, for people who've had both shots, here's a booster that's got the variant only in it. A new shot that's got the variant in it, so you don't have to get you don't have to get the 3rd shot. And then there was another one, I forgot what the 3rd shot was, but they were really going after it in 3 different ways. So I think that's the great news about these mRNA viruses. They can change on a dime.
Yeah, absolutely. We heard that they could pivot and change, within 6 weeks if there's a new variant identified that's starting to become more of a dominant population. They can do that, and it looks safe, and the FDA has said that you don't have to go through all the safety protocols just by changing the spike protein itself. So I don't think we have guidance yet, but, if you've gotten 2 doses of the original, probably just getting a booster at some point in time. We don't know when, if that's 6, 9 months, a year from getting that second dose. I think it's going to determine what the infection dynamics are with that particular variant. And unfortunately, we know the variants, not the variants, but just any variants are going to pop up at any point in time. We have that technology to detect them with the genome sequencing. And so I think those will be different in any certain population or community as well. We just have to be ready that there will be more information that a new variant here, a new variant here, or a new variant in this country over here is arising. But we still need to fully vet them and understand, are they really more infectious? Is this a behavioral thing? Is that why they're spreading more? Is there any increase in mortality or change in the clinical disease? So.
Yeah, it's going to be interesting, and we're excited to see him. Jill, any other questions? All right. Good morning, Michelle.
Good morning.
Thank you so much for being here. And you are a brave person. This is impressive to me. Thank you for being on the show today and to share your story. I want to begin publicly saying how sorry we are for your loss. And this has been, this has been kind of unspeakable tragedy, really. Everyone in your immediate family contracted COVID-19. And then both your parents died of COVID-19 within days of one another. How are you holding up?
I'm trying my best to continue my faith and continue to educate people on the importance of, like what you said, the vaccine and masking, because within my own family, masking worked. Unfortunately, after my dad went back to the nursing home, he was not masked and contracted the virus there, but he did not catch it from me nor my mom when he was here in the hospital because we were both masked. And I even kissed him through my mask, and he had his mask on, and he didn't contract the virus from us. And I was already shedding the virus at that point. And so I'm trying to hold up. Trying to do what's right and make sure that, I honor them and make sure that everybody knows the importance of this and how it's real and it affects more than just those who are lost.
And I'm going to tell you, you do it every day when you're here. We know how hard you're working. We know how well you're working at it. I think you brought your mom's rosary today with you. Is that right?
I did.
Yeah. It's got to be help to get through this, and that's hard. They both just had their funerals.
Yes.
I can't. I lost my mom and dad when I was pretty young, and so that's a tragedy. How has that impacted your immediate family?
Well, I can see their picture. It's impacted us in a way, not negatively. It's actually brought our family much closer, and we've all been able to lean on each other, and we've had so much support from not only our family, the community. My staff has been amazing. The deaf community, bless their hearts. I love them so much. And we're all very thankful. Our immediate family is so thankful for all of you. Jill, Dr. Stites, Dr. Hawkinson, Logan, Anthony, Jessica, Unit 61, Unit 65, the ICU nurses, Laura, Sarah, another Sarah, Sharon, and Shannon, Greg, and Brian became family to us. I can't say enough about what KU, how they became our immediate family also. So it's affected us, but we've realized that life is too short, and our whole family is trying to spread the word of how vital it is for masks, how important it is to get the vaccine. 500,000 people just here in the United States, and 2 of those are my parents. And people like to say, oh, it's only like 1.4% death rate. That's 98 million people, if you do the math. That's 98 million too many, 500,000 too many. And if we just do our part, especially here in the United States, we're the United States for a reason. We're united. We come together, and we shouldn't lose that way. We should be united more now than ever. And it's hard. It's not just affecting those who are lost. It affects the families, the children, my boys, my nephew. They're devastated. My 6-year-old, he's now 7. He just turned 7, cries every night holding my parents' photos. And we don't need more deaths. We need more unity.
That was beautiful. Thank you. You and Mr. Garmacher have kind of been the ones who really have just told the story so well, much better than I ever can all these days I'm here. So thank you for that. I'm reminded of the first words. I think you've been here when we said it before. We the people.
Yes.
Not I the one.
Yes.
We the people. Dr. Nawalanic, thanks for joining us. Sadly, Michelle's story is all too common during this pandemic. What words of advice and comfort do you have for her and others who are struggling with death from COVID-19 during this pandemic, and sometimes the inability to even have closure with funerals and things of that nature, whether it's from COVID-19 or others?
First, thanks for having me. Michelle is to quote Hamilton, I think she's going through the unimaginable would be the best way to put it. And, there's someone far more wiser than I that said that grief is the price that we pay for love. And it's a true statement. And it's, I think that people look for answers and try to find a reasonable way to get through and hope that there's some right path. And I think that there's even some misinformation out there kind of through pop psychology that there are these concrete stages of grief that one has to go through, and that if you're not hitting them all or in all in the right time, in the right order, that you're doing it wrong. And that's just not the case. It's not true. And I encourage anybody who is struggling through this to just recognize that this is something that's going to take time, and give yourself the grace to go through this in whatever way makes sense for you. There's research now that shows that there's kind of more a two-pronged approach where we go from a grief focus, where we're actually kind of really bathing in the emotional stew and experiencing those negative feelings, and then a restoration focus and orientation, where we're actually going through the business of life goes on and doing the things and upholding the demands that we have, whether it be professional, personal, familial. And so I know, for right now, Michelle is clearly trying to be in that restoration orientation, and there is no clear-cut delineation between the two. But there will certainly be variance and back and forth between both, and that's okay. And one of the best things that I think has occurred in terms of research in this area is that we've moved, there's been a real shift from letting the people go toward actually maintaining and modifying the relationship with them. And what that looks like is, when you have a therapeutic relationship with a therapist, you work with them through a specific problem or issue, and then once that goal is met, you eventually taper off into maintenance, and then you terminate. And it's not that you never ever think of that therapeutic work again, but you develop, the goal is that you have an internalized voice of that therapist in your mind that can get you through situations. So it's very similar to that, a therapeutic relationship is very brief. A love relationship, a familial relationship is lifelong. And when it ends, you're still going to hear their voice. You're still going to have them, and you can still go to them and maintain that relationship. I mean, things like, for example, carrying that rosary. I know that right now Michelle's probably feeling her mother there. And that's a positive, and it's okay. It's actually the goal is to recognize that we don't have to let them go. We just shift. Death ends a life. It doesn't end a relationship. And so it's important to maintain that orientation and keep that connection.
That's also wonderfully said. Emotional stew, the unimaginable. I love Hamilton. And, do not throw away your shot. And grief, the price of love. And I think you clearly have loved your folks, and the grief is hard.
It is very hard. It's funny that Dr. Nawalanic said that, and he's also been amazing and by my side every step of the way. So I thank you so much for that. And he checks in on me because I kind of lose my way. But he's exactly right. I haven't stopped my relationship with my parents. When they both were in the hospital, I made it a point to call in and Zoom and say their prayers every night for them, with them. And I haven't stopped. It's just different. And I'm not going to stop. And I'm going to continue that because, like what he said, I hear my mom's voice all the time. I hear it. I hear my dad. I hear my mom calling me Missy or Dolly because that's how she used to say things. There's just things that remind me of both of my parents. And I see it in my children. I see it in my nephew. I see it out in the community. And so that's helped me. But it's still very hard because I just want to hug them again. And I personally feel like they were taken too soon, but I also have found my way back to my faith in God, and I believe my mom's calling here on earth was to take care of my dad. My dad was going on 12 years of fighting terminal cancer, along with being diagnosed with Alzheimer's about 4 years ago, and my mom and dad were perfect testaments of, for better or for worse, for sicker and for poor. Like, they never left each other's side, and I think my mom's work here was done, and God needed her to come before my dad, and I just won't let their passing be in vain. That's why it's so vital for everyone to get their shot. I know people say things like, well, is there a microchip in it? And I kind of laugh, and I'm like, well, if you have a smart device, which everybody does, you're already tracked. You know, that's how they figure out homicides. They can ping you anywhere. That's silly. You're doing it not just for yourself. Getting the vaccine and wearing your mask says that you love people. And that's what we need to go back to. And I know that if talking today about my parents saves just one person, then I know both of them would be looking down and saying it was all worth it. Because that's how they were. They loved others more than themselves.
Well, that's been expressed in their children. Jill, you ask a question because I can't talk right now.
Okay. Simone is wondering if you would mind sharing the ages of your parents and how long they suffered with COVID.
Absolutely. My mom was 66, and my dad was 69. My mom had no pre-existing conditions. My dad did. My dad had everything under the sun. My mom was diagnosed with COVID-19. We all were on Christmas Eve. And she suffered ever since. And she passed away on February 4th. She fought harder than anyone I've ever seen fight other than my dad. And my dad, they had tested him at the nursing home for more than 14 days. He came back negative. And then unfortunately at the nursing home, he was in contact with a caregiver directly and then tested positive. 3 days later he was rushed to the hospital on the 7th of January. And he got severe. He overcame, he didn't suffer from pneumonia, which you would think he does. He has diabetes, high blood pressure, he has an ileostomy, Alzheimer's, cancer, blood clots already that were in his lungs, but that's not what got him. It was what COVID does to your brain. And I think there's not enough awareness out there for COVID patients who have Alzheimer's, because that's ultimately what happened. And I don't think my dad suffered as much. My dad suffered for 12 plus years, and he was actually very peaceful. When he went to hospice and he passed away on February 9th, my entire family was like, this is the most peaceful we've ever seen him. And so his suffering wasn't, I feel like it wasn't true suffering. It was his time. But my mom, that vision of just being in the ICU room and being with her and seeing all the vents, the vent and the trach and numerous of IV bags, that was hard. And her being on dialysis 24/7. So she fought a long battle. But she's at peace now.
I've been an ICU physician for many, many years, more than a quarter century. And what you've said about the team of people who take care of folks there is just so darn true. The nursing staff up there are angelic, and they have to put up with people like me and do an amazing job with patients. Dr. Nawalanic, other thoughts? How do you cope with the loss of love like that? Or in this case, how do you continue to expand love when it may not be in such a corporeal form?
Well, I think that you touch on something very important, which is finding meaning and trying to, for Michelle, with her father, it's looking at the fact that ultimately the end gave him peace. And so that's an important thing on which to grasp. As far as the rest, like what Michelle's doing this morning, of taking on a purpose and having almost a drive and a mission, some way to carry on and honor their legacy. That's what we look for, is trying to figure out, because the loss of a loved one, what it really does is holds up a mirror to us and our own mortality in a certain way. It's obviously about losing someone who's very close to us, but there's in the background a little bit of a reminder of the fleeting nature of life, and that you think you have all this time. And in reality, we never know. Tomorrow is not a guarantee. And so that sounds like a real downer statement, but the turnaround to that is that you have the moment that you have right now. And so the drive here is to find, are you doing everything you can? Are you taking advantage of the opportunities that every morning waking up gives you? Are you living actively? Are you sitting passively back and letting life kind of steer you? So I think that memorializing a loved one through living better and living a more directed and purposeful life is ultimately the best gift you can give them from the other side, if you have that belief, and also yourself, because you're going to be able to hold your head high and know that you really honor them through your life. And I think that that's one of the important shifts that I hope that people can get to. The other piece of this, obviously, I hate for this to be like a scared straight moment, but this came out of nowhere for Michelle and just devastated her life. And I think that it's upsetting, really critically upsetting, because she was someone who took this seriously. So even the folks who are taking it seriously, it can creep up, it can snake bite you. It takes a moment. And so for the folks who are more irresponsible, I hope that we can reach them somehow through this and emphasize the importance to try to avoid this. This is real. It's not some media created, circumstance. This is very real. And I think that we've all seen in the last, 6 months, a major shift from tertiary stories and secondary, maybe somebody knows somebody, to it's impacting people we know. We're seeing this hit close to home. And I think it's a painful reminder. The number 500,000 is overwhelming. And it's something that I think as the number's grown and we keep hearing it get updated, it becomes kind of almost desensitizing. But I encourage everybody to sit for a minute and imagine 5 football stadiums full of people. What does that look like to you? And think of how many lives are touched by every one of those losses. That's what we're dealing with.
The city of Kansas City, I believe, has a population of 450,000 people. Imagine that city just disappearing in 1 year's time, plus a few suburbs. That's what's happened.
I got a mom that wants to remain anonymous, and she said that she has a KU student. I think I hear fear in her text, so we might address the fear too. But the student has tested positive for the second time in 7 months with COVID, and they use PCR tests, and never hospitalized, but suffered. Wants to know, how do I know if this is the new strain? Or is it the old strain? And should we be concerned? She just has a lot of questions.
Hawk?
Yeah. Well, right now in Kansas, we aren't aware of widespread variant infections. Certainly we know reinfections can occur. If this is a college student, take a little comfort in understanding that that person is young, so they more than likely will be okay. We still don't know all the dynamics of what happens at reinfection. At 7 months apart, I would suppose it's reinfection, but again, I don't know all the details of this case. And as far as looking for new variants, it's very difficult unless we have the genome sequence from the first infection. We compare it with the genome sequence from this infection. We know that the state itself is increasing or ramping up the sequencing, and if they do have a medical provider wherever they are at, that medical provider, in Kansas can talk with KDHE. They can submit that sample to see if it is a new variant or if it's one of the variants that we know about. But again, I would take comfort in knowing and understanding that if this is a young person, their risk is greatly decreased. It's not zero, but their risk is greatly decreased from having severe and critical illness. So I think that is one good thing. We know that really the severe critical illness, especially in those over 60 and over 65, their risk is much higher. But being a young person in college, they should still be okay. But again, we don't know the full dynamics of what happens on an individual level, but also in a population level with reinfection.
Mary has a granddaughter who's going to be honored at her last high school basketball game. Mary has had both her Pfizer shots. Mary also cares for her 94-year-old mother. She wants to know, is it safe for me to go to the gymnasium?
That's a great question, and unfortunately, I think the evidence is incomplete.
Yeah.
A, if you're going to go, wear a mask. B, I hope everybody else in that gym has a mask.
Yeah.
And C, sit away from everybody. Because D, we don't know that the vaccines really protect you from asymptomatic transmission. You can still get the disease. We think the odds of getting it are down by about 2/3. That's what the preliminary data is beginning to suggest. But there is still a small incidence, and what the New England Journal publishes articles online that anybody can access around COVID. And there's one that got published last night about the effect of Israel being vaccinated, and there is still a slight incidence of your being able to get and transmit the disease for a while after you've had a shot, after you've had your vaccination. So I think you just have to be cognizant around your 94-year-old mother that you could potentially take it there. And so the only way to do it, and this is one of those things in life where you just have to weigh the risks. There's no right answer. There's no wrong answer. There's just, how do you weigh this scale in your life? There are things you can do that we know markedly reduce the likelihood of transmission. Vaccination clearly is one of them. Masking is another. Washing your hands and keeping your distance. And then when you go see your mom for the next 10 days, you got to kind of wear a mask and keep your distance until that risk of you're getting it and passing begins to pass on, because you may well be asymptomatic.
Yeah, I think that's exactly right. It's risk mitigation. This person sounds very thoughtful about that. So, do the mask. If you can wear eye protection or a face shield in there as well, that would be good. And distance yourself from other people as much as possible. 6 feet is okay. 8 or 10 feet as much as possible. In a gym, we understand it's an enclosed space. But those are difficult things. But I think if you do those things, you can certainly reduce that risk.
And you may walk in and people may kind of look at you funny, and they make you feel funny if you have your mask and face shield and goggles on and all that. But Michelle, it's got to be a lot worse feeling to think you may have been the person who gave it to your mom.
Yeah. I wanted to touch on this person's comment, to talk to their mother also, their loved ones, because we, like what everybody had said so far, is we were doing everything right. I was getting on if my mom went anywhere, and I was like, you got to do Instacart now, all of these things. When we we wore masks and social distance from my parents, more so for my dad, because he was such high risk. And once he moved to the nursing home, we talked with my mom, and because our bubble this whole time had been myself, my husband, my 2 children, my brother, my sister-in-law, and their son. That was our bubble. And my mom, after my dad was moved to the nursing home, struggled being alone. And we sat down as a family, and my mother was planning to move in with me, and we talked about, the risks and the benefits. That's something that you've talked about this whole time, and I took that knowledge and brought it to my family, and, my mom said, if I'm going to get it, I'm going to get it. But I don't think she
didn't know what that meant.
She didn't know what that meant. And if I could go back, and if there's any advice I could offer you, talk to her and make sure that if you decide to go visit her, wear the mask. Wear that mask, because the guilt of if you gave it to them, or where did it come from? Could it possibly have been me? Is a guilt that some of us have to live with for the rest of our lives.
You bet.
And that's a hard guilt, and I don't want that for you or anyone for that matter. So that mask is so vital, and I don't want to add to the 500,000, and I'm sure that this loved one doesn't either, and that's why they're asking.
So I'm going to have Michelle run this program from every day forward.
Oh, no.
Greg, thoughts?
I think, turn it over to Michelle.
Yeah.
I think that really I know that people are probably starting to get tired. I'm hearing different, relations and folks talking about, I'm over this, I'm done, I'm starting to plan things, and I keep being the critical voice of reason and trying to remind. And I think that when folks hear the numbers going down, they get this artificial sense of confidence that we're coming out of the other side. And the reality is that it just takes, and this weather that was gorgeous the last couple of days was really kind of alarming to me. I was like, oh boy, here we go. And there's a little bit of cringe, because I think that we have to remain mindful of history, or lest we be damned to repeat it. And, it's an issue where we've had too many, dismissals of this and flippant response and saying, oh, it's getting better. Let's get out and do things. I want my life back. And I think if we can remain diligent and stay the course, we will be rewarded. It's just, this doesn't feel like it's that time yet. And I know that for some people, they really want to believe that it is, but we've just got to stay mindful. We've got to take care and expect the unexpected, and know that if it hits, it could be devastating. And so I think let's try to continue, the progress that we're making, get the vaccine, take the choices. And I know that, there is still very much a lot of fear around this thing, because there are still a lot of unknown variables. But the things that have not changed, as Dr. Stites, you love to say, is the pillars of infectious disease control. It's the wearing the mask, washing the hands, not touching your face, keep your distance. These are not difficult things to do. It's habit forming. I think that now we're getting to a place where we're kind of used to it. So let's just keep it going, and then reap the benefit once it's actually safe to do so.
Jill, one more question.
Lee wants to know if Dr. Nawalanic could speak to the anger, the angst, the irritation around not being able to get a vaccine, people feeling like their older parents and older population should be getting it ahead of others. Do you have any thoughts on that?
I think that, managing the anger, it comes down to, I think that in America we have an individualist mindset. We're not really adept at the collectivist cultural setting. I don't think our selector switch really goes there very easily. Cultures like Japan, very collectivist. The individual exists as part of the whole and for the benefit of the whole. That's kind of the mindset that we need to be trying on. It has to be less about me and more about us. And I think that, Michelle touched on the we the people earlier. I think that's important to remain mindful of that. And so we have to be patient. And anger exists as a secondary emotion. It's always going to be fueled by discomfort, fear, embarrassment, guilt, shame, uncertainty, anxiety, any of those goopy negative emotions that are very passive in nature. And I think, unfortunately, human nature is what it is, and the American way is what it is. And there are going to be people who are going to offer this thing for sale to the highest bidder, and it's completely unethical and completely inappropriate. But when people hear that and they see it, they think this is a widespread occurrence and that somehow they got to get theirs. And it becomes kind of like the new toilet paper, where we're trying to cut people in line. And I heard this place has it and rush there. And, we're just trying to exercise control over that, over which we have little to none. So I encourage people to just try to stay calm, stay cool, wait your turn, trust the experts in the rollout on this, that they've made their choices thoughtfully and carefully. And I would certainly turn it over to, Drs. Hawkinson and Stites to address, the specifics around the distribution more than I could.
Anything you want to add, Hawk?
No, I completely agree. We've talked about the vaccines before, and it's a supply issue right now, and we would like every place to have it, surplus supply like we do for influenza vaccine or pneumococcal vaccine. But I think Dr. Nawalanic said it greatly about the psychiatric psychology of all that.
And just to say, we've said on this program before, faith, hope, and science. We spoke a lot about faith today. Thank you. Hope and vaccination, which represents science. And for a while, the timeline was, gosh, we may be starting to open up wide open to vaccination from all phases, even in April. Then that got pushed back to May, June. Now it's starting to inch its way back toward April again, because Pfizer and Moderna look like they're going to be able to ramp up production. And in addition, we'll be seeing the arrival of J&J on everything. And then we're not far behind with Novavax, which also looks great and very active against variants. And then maybe AstraZeneca. So good stuff out there. Hey, tomorrow we also have a little touch of hope, because we're going to be talking about the Kansas City Royals and spring training. That is a touch of spring right there, right? Dr. Vensky, the head team physician for the Royals, is going to join us from Surprise, Arizona, and training camp. It looks a little different this year. Dr. Key is going to talk a little bit about how they're going to keep the players and staff safe, what baseball is going to look like next year, and maybe if we're going to be back in decay. So Dr. Key is a good friend of mine. He's also, I think I helped pay a couple of his kids way through college, because he's operated on me a couple of times and most of my family. So that'll be a great conversation. Unfortunately, I won't be here to mess with him, though. Dr. David Wild will be here tomorrow. He's also going to run some numbers with you. So that'll be a good program. Final thoughts?
Final thoughts. I wanted to quickly touch on the person who just commented about the anger and the frustration. I know that feeling very well. I was very angry and frustrated at the fact that the vaccines if they would have rolled out 3 weeks sooner, my mom could have gotten them. But try and replace that frustration and anger with patience, because if you're patient, it'll be worth it. And then you won't have to go through the grief that so many people have gone through. And so really, my final thoughts are love each other, be there for one another. Remember that if we can do this together, we'll be in a much better place. It will bring, I know so many people have hurt throughout this year over so many different topics, so many different things, but if we can come back together as a whole, I think it will be beautiful. And because I know most of us want happiness for each other. Humanity is good, and I've seen it. I've seen it here, or I've seen it out in the community. From the mayor, KU, the deaf community, my employees, my family, my children. And if we can take all of that, we are going to get through this. We really will, but we have to be mindful of each other and for once not think of ourselves, think of others, because that's how we're going to get through this. And get your vaccine, wear your mask, social distance, wash your hands, cough into your shoulder. Anything and everything that Dr. Stice and Dr. Hawkinson have said they're the works of God themselves.
You're way too kind. Yeah. Dr. Nawalanic, final thoughts?
I think how do you follow that? I'm just going to say, let's just take care of ourselves and take care of each other. Try to be kind and be patient. And I think we're getting there. And I think that we have a lot of exciting developments on the horizon. And, that light off in the distance might not be a train. Let's just try to get to it. Let's take our way and take care and get there.
Yeah, I think I would echo what Michelle said, what Dr. Nawalanic has said. About compassion and a collective. We do respect individual liberty and freedom here in the United States, but just as you said in the past, with that individual freedom comes responsibility, and so I think we need to continue to do that towards our fellow Americans and Kansas Cityans and really work towards that collective.
2 short stories. I lost a dear family member in the late 90s from HIV. And just days before new therapy for HIV came out. And that death still marks me and everyone in our family. He's a very good man. And, you don't want to be in that position, right? You don't want to be your parents. And you don't want to have to suffer from something that if you could just been a little more careful. And then watch the new therapies come out and say, what if? Second short story, my brother was an irascible character, and we didn't always get along, but I always knew he loved me. And he did that, and he showed it in funny ways. One of it was a train locomotive alarm clock, which he schemed with my oldest child to put under the bed of my wife and I, and would go off at 3 a.m. I returned the favor back to him, and it may have gone off in his room a few times, and then it may have come back to me. Eventually, the locomotive alarm clock found its way off my roof. I really don't know how that happened. But that was his way of saying, I love you. When Lin-Manuel Miranda accepted the Tony Award for Hamilton, what were the 3 words he said? Love, love, love. We the people. We'll be back with you tomorrow.